Hey friends, and a very warm welcome. If you're watching this, chances are your life has been touched by kidney disease. Maybe you're the one navigating the daily realities of dialysis, with its scheduled treatments and dietary restrictions. Or perhaps you're a dedicated caregiver, a loving family member, or a supportive friend standing by someone you care about on this journey. We know it's not always easy. It can be a path filled with questions, uncertainty, and sometimes a feeling of being overwhelmed by a sea of medical information. Our goal here together is to cut through that noise, to bring clarity and to empower you with knowledge, because when you're informed, you're in control. So today we're going to talk about a powerful concept that could fundamentally change the way you think about your treatment and your health. It's called evidence-based practice. Now, I know what you might be thinking. That sounds incredibly technical, right? Like something you'd hear in a medical school lecture or read in a dense research paper. It sounds like jargon meant for doctors and scientists, not for us. But I promise you, the idea behind it is actually wonderfully simple, and its impact on your care is profoundly important. So what is it, really? Let's break it down. At its heart, evidence-based practice is a three-part approach to making the best possible healthcare decisions. Think of it like a three-legged stool. The first leg is the best available scientific evidence. This means using treatments and strategies that have been rigorously tested and proven to be effective and safe. It's about moving away from "this is how we've always done it" and embracing "this is what the data shows works best." The second leg is the clinical expertise of your healthcare team, your nephrologist, nurses, and dietitians. They use their years of training and experience to interpret the research and apply it to your unique medical situation. But here's the crucial third leg, the one that makes the stool stable and strong. You. Your personal values, your preferences, your goals, and your life circumstances. Evidence-based practice insists that your voice is not just heard, but is a central part of the decision-making process. This isn't just a theoretical concept. It has real-world consequences for your well-being. It means your treatment plan isn't based on guesswork, but on a solid foundation of science. It can lead to better management of symptoms, a lower risk of complications, and ultimately a higher quality of life. It empowers you to step into a partnership with your care team. It gives you the confidence to ask questions like, "What does the research say about this option?" Or, "What are the pros and cons for someone like me?" It transforms you from a passive recipient of care into an active, engaged participant in your own health journey. And that, my friends, is where the real power lies. Have you ever heard the term evidence-based practice, or EBP? It might sound technical, but it's a deeply personal and collaborative approach to your healthcare. It's about ensuring the care you receive is the best it can possibly be, tailored specifically for you. At its core, EBP starts with the best available scientific evidence. This isn't about fleeting trends. We're talking about high-quality, peer-reviewed research from around the globe. Large-scale clinical trials that rigorously test which dialysis techniques or medications lead to better health and an improved quality of life. This solid foundation of science means your treatment isn't based on old habits or guesswork, but on a global consensus of what is proven to be most effective and safe. But science is only one piece of the puzzle. The second crucial element is clinical expertise. Your care team brings years of invaluable hands-on experience. They understand the nuances that data can't always capture. They use their professional judgment to interpret the research and apply it to your specific health profile, anticipating challenges and recognizing subtle signs. They are the skilled navigators who translate the scientific map into a practical, real-world journey for you. And the final, most vital component is you. Your preferences, values, and life goals are central to every decision. This is a partnership. What matters most to you? Is it maintaining a work schedule, the flexibility of home dialysis, or the community of an in-center clinic? Your voice is essential. We'll discuss all the evidence-based options, and together, choose the path that aligns not just with medical facts, but with the life you want to live. So, evidence-based practice isn't a rigid formula. It's a dynamic conversation that blends science, experience, and your personal expertise. It's the commitment to move beyond what's always been done and embrace what's been proven to work best for you. To truly understand the impact of evidence-based practice, let's walk through a common yet critical decision in dialysis care: choosing a vascular access. This is the lifeline that allows your blood to be cleaned. Recent research by Fitzpatrick and Dunlap in 2022 highlights how evidence-based practice empowers nephrology nurses to advocate for the best possible access for their patients. Let's imagine two different people, both needing to start their dialysis journey. We'll call them Patient A and Patient B. Fitzpatrick and Dunlap's article emphasizes that using current evidence is a critical tool for nurses to guide patient education and clinical decisions, ensuring that each patient receives the most appropriate care. Let's say Patient A gets an AV fistula for their dialysis access. According to Fitzpatrick and Dunlap, the research consistently supports arteriovenous fistulas, AVFs, as the preferred access type. Why? Because AVFs have lower infection and thrombosis rates and offer better long-term outcomes compared to grafts or catheters. Their article highlights that a fistula, created by connecting an artery to a vein, is a long-term investment in health. It may take weeks or months to mature, but the evidence shows it lasts longer and is safer, with fewer complications. For Patient A, this choice represents a durable and safer lifeline for ongoing treatment, guided by the best available science. The article also notes that despite these benefits, many patients still begin dialysis with catheters, which carry higher risks. Now, let's consider Patient B. Their situation is different. They need dialysis urgently, so there's no time to wait for a fistula to mature. Patient B receives a central venous catheter, which can be used almost immediately. This speed is life-saving in emergencies. But Fitzpatrick and Dunlap's research highlights the significant risks. Catheters have much higher rates of infection and blood clots, and can even make future access more difficult. Their findings encourage nurses to use current evidence to promote timely AVF creation and individualized care planning, reducing reliance on catheters whenever possible. For Patient B, the catheter is a necessary bridge, but the goal, supported by the latest evidence, is to transition to a safer, more permanent access as soon as possible. Fitzpatrick and Dunlap advocate for a patient-first approach, where access decisions are tailored to each person's unique needs and preferences, aligning with the development of an end-stage kidney disease life plan. So, is the catheter a bad choice? Not at all. In Patient B's urgent situation, it was the right, evidence-based choice, guided by both clinical context and the latest research. This is where the nuance of evidence-based practice shines. It's not just about picking the option with the best statistics. It's about applying that data to an individual's unique clinical context. The article encourages nurses to work with patients, weighing long-term benefits against immediate needs, and using the best available science to guide every step. That's the difference evidence-based practice and a patient-first approach can make. When you understand the science behind your care, you can ask better questions, make smarter choices, and feel more in control. That's what this channel is all about. Next up, we'll bust some common dialysis myths. Hit follow, share with someone you love, and let's make dialysis smarter, together.